Hi, everyone, and welcome to another Gypsy Nurse Live event. I am Rachel Alton, the online community manager for the Gypsy Nurse, and we have some pretty familiar faces joining us today. But for those of you who are new to the Gypsy Nurse, we are the largest and most active online community for travel healthcare workers. We're proud to be a one-stop shop resource for travel nurses, allied, anything travel healthcare, whether you're new to it, have been doing it a while, or ready to finally take that leap. We have tons of articles and videos to help you get started, a job board to help you find your next adventure, housing to help you find a place to lay your head, which is from Furnished Finder, discounts, and so much more. We do these live events once or twice a month with industry experts, our sponsors, and other travelers to give our community a chance to ask their travel healthcare questions in real time with someone who knows a thing or two about travel healthcare. And you can also listen to these and the other ones on demand on thegypsynurse.com as well. Also, while you're on the gypsynurse.com, be sure to sign up as a member to be included in upcoming contests and receive updates on the infamous TravCon, which, if you don't already know, the TravCon is the largest travel healthcare in-person conference out there. And yes, I'm including you, Allied. You definitely need to be there. TravCon is full of education, fun, and an epic after party. And you don't have to be a travel healthcare worker to attend. If you are looking into travel nursing, they have a newbie boot camp just for you to learn how to become a travel nurse, travel healthcare professional, and you can have a little bit of fun too while you're learning. So be sure to save the date. It's September 17th to the 20th, 2023 at the Paris and Las Vegas, Nevada. Early bird tickets will be going on sale on April 3rd, so be sure to be on the lookout for that. You'll go to travcon.org and go get your ticket. If you're alumni, if you've been before, tickets are on sale now, so be sure to check your email, look out for that. So much fun stuff happening right now and throughout this year, so be sure to register as a member so that way you can stay up to date. So now I'd like to bring on a Gypsy Nurse favorite for a Q&A session for new travel nurses. This session will provide an open and friendly platform for new travel nurses to ask questions and get advice from Medial Edge Recruitment's Director of Clinical Services and ICU RN, Christie Purviance, and Ashley Johnson, Medial Edge's Provider Experience Specialist. So they are offering complimentary coffee to anyone who joins and engages. So let me go ahead and bring them up. This is going to be a great session. Hi, ladies. Welcome back.
Hello. We're so excited to be back.
Yeah, so happy to have you guys on. And what a great topic. Lots and lots of people are wanting to become travel nurses, travel healthcare workers. So, what perfect topic to discuss to get them excited about it?
Absolutely. So we're super excited. As Rachel said, I'm Ashley, and this is Christy. She's our Director of Clinical Services and experienced RN. So we're super excited to just kind of have an open conversation about travel nursing, what to expect on your first assignment, and things like that. We're excited to engage with the comments and see what questions you guys have. So just as some housekeeping things, please make sure to be respectful at all times in the comments. No hate speech or discrimination or anything like that. Also try to stay on topic, anything relevant to nursing or travel nursing or anything like that. And then we do have our moderators. So backstage or back screen, we have our social media specialist, Dom. So he's going to be filtering through and letting us know any comments that we have. Feel free to ask us anything. As a start, do you want to give like an introduction about yourself?
Yeah, absolutely. Hey everyone, thanks for joining us. My name is Christie Purviance and I am the Director of Clinical Services with Medial Edge. I've been a nurse for almost 5 years and I worked in the ICU for about 3.5 years where I did about 9 months of local travel contracts before joining Medial Edge. So,
yeah. And it's been so awesome since she's been here. She's been a huge help with all of our clinical services efforts and any question that any provider has, like she always has the answer. So we've been so excited to have her join the team, and she's done such an awesome job since she's
Thank
been
you.
here. So of course, like we said earlier, we're going to be talking about travel nursing, things to look forward to on your first assignment. To kick everything off, we both brought in our favorite mugs, coffee.
Cheers.
So mine is from St. Lucia. We just came back a couple weeks ago. Christie's is way more special though. Do you want to tell us?
Yeah, so I have a 3.5-year-old son, and they made this for Christmas at his daycare with his handprint. So.
And his name is Ashton. So
Yeah.
Ashley, Ashton.
Yeah.
We love him automatically. All right, awesome. So to start, CP, do you want to tell us a little bit, because you were a travel nurse?
Mhm.
So regarding your first assignment, I would love to hear about just your overall experience and how that was.
Yeah, so when I decided to start traveling, before I made the decision, I felt very loyal to my hospital. I'd been there for so long. And with COVID and the pandemic, myself and a lot of nurses quickly realized, travel was the best for a lot of us. And so I knew I didn't want to be far away from my son. At the time, he was 9 months old.
Wait, you just said 3.5, and now he's 9.
He was 9 months. He was 9 months old when the pandemic started. And by the time I went to travel, he was a little older, but I wanted to stay close. And fortunately, I live in an area where there's tons of hospitals. So I chose my first assignment. It was local, about 20 minutes from my home. I chose that location because I knew people that worked there. And one of my closest friends worked there. It was a ICU, like a general CV ICU. And I worked there for about 15 weeks. And it was very eye-opening. That's for sure.
Yeah.
Yeah.
So as far as like the actual facility goes, I mean, what was your day-to-day, or how was that?
Yeah. So when I got there, orientation, it was one shift, and I learned where everything was, and then I hit the ground running. It was nice because a lot of the physicians and nurse practitioners and consulting physicians that I worked with at my other hospital, because they were so close, a lot of them I saw at my contract. So the familiar faces made it a lot easier for me than I think maybe for a new traveler going to somewhere that they don't know, or in a city that they've never lived. But it was, as far as the nursing care, it was very similar. The hardest part was the way that hospital system did things different from what I was used to, and having to adapt in a very short time period, to do things their way.
Right.
Yeah.
I gotcha. And we did have a question come up. Lucia asked if this was only for RNs. So no, this is for any traveler, RN, CNA, allied, LPN, anyone who's interested in travel, not specifically just RNs. Sorry. So everything was, it was a little different, but of course nursing is going to be the same anywhere you go.
Yeah, for the most part, nursing care is nursing care. Just with different regions, you have different patient populations. For me, that wasn't really anything I had to adapt to because it was in the same city. I think the biggest shock when I got there, I came from a system, and at least the units I worked on, between like a med surg ICU and a trauma ICU, we were very traveler friendly, especially on night shift. We loved travelers. And at my contract, most of the night shift nurses were, but the day shift nurses were, it was just a total culture shock in that regard. It really felt like high school, to be honest. So you have to have thick skin if you want to travel. That is, I would say, hands down, like with characteristic traits and personality traits, thick skin, and hold your own.
Yeah.
Yeah.
So it sounds like it could be pretty stressful, just like going in and everyone knowing that you're a traveler, or that you're on a contract, and knowing the differences between them and yourself. So how did you kind of push through that mentally? Because I'm sure that really took a toll on you.
Yeah. So I was there to do my job. I avoided any drama or anything that didn't relate to my patients and the patient care.
Mhm.
I left work at work. I didn't let the comments, come home with me. But I also didn't give any like or add fuel to the fire. So
Mhm.
I didn't talk about my pay like some people do, and transparency is great, and I absolutely support it. But I was there to do my job, not to cause a rift.
Right.
I was there for the financial gain to benefit my family,
Yeah.
and I knew I was there for a short time, not a long time, and I wanted to just get the job done and go home.
Yeah. Yeah. So it sounds like it's just locking in, focusing on your
Yeah,
patients and your work,
yeah,
and leaving all the other
yeah,
stuff where it is.
yeah,
That's
absolutely.
awesome. Yeah. I mean, I feel like that's what you have to do. Otherwise you can get sucked in really easily.
Yeah, and especially with nursing or really anything clinical, you have to be completely focused on your patients.
Yeah.
And when you get, sometimes it's really easy for our feelings and emotions and the way we feel about things, whether it be work or outside of work, to get in the way of our performance at work and
Mhm.
how well we do. But when it comes to patient care, like, you have to stay focused and committed, or that's when mistakes happen. So
Yeah.
just my friendly piece of advice, do your job and leave work at work and leave personal, at home.
Yeah. So we actually got a comment from Reagan asking, "What's your number one piece of advice for anyone thinking of travel nursing?"
Okay.
That's a
Yeah.
good segue, right?
Yeah. Well, hi Reagan. Thank you for the question. I would say do your research. There's a lot of considerations to think of when you're starting to travel. If you are thinking of going to an unfamiliar place, really do your research. You know, I mean, you speak with a lot of new travelers.
Mhm.
Definitely, like, safety in the area is definitely important. For me, I only did local, so I can speak on local experience. I think for travel, Ashley might have a lot to
Yeah.
say.
Yeah, absolutely. So I think exactly what you're saying, right? Do research outside of, maybe what your recruiter is telling you, or maybe like I know for you, you had a couple friends at the
Hmm.
facility. So maybe outside of what your colleagues may be telling you, do some research on the area, on the facility, on the typical patient you might see, different things like that, just to make sure that, the facility or wherever you're going on this assignment is the right fit, because at the end of the day, you don't want to go to an assignment and not be happy, or missing home or anything like that. You want to make sure that it's a good fit for you. So that would be my number one piece of advice.
And you know what? I just thought of if you're thinking of traveling, start with a local contract and
Mhm.
see if contract nursing and travel nursing is right for you. That's a great way to test the waters and maybe stay PRN at your job and go from there. And if you hate it, then go back to your job.
Right. Yeah, that's awesome.
Yeah.
That's a really good piece of advice. I love it. So, as far as like, going through like everything regarding like
Mhm.
the facility and the
Yeah.
staff and the mental stress and everything, what was one thing that, aside from the patients, that really kept you going? Like, did you have colleagues that you were able to connect with, or maybe,
Yeah.
talking to your family? Like, what was one thing that just kept you going as far as like being a travel nurse
Yeah. And
or a
with like
traveler?
my mental health
Yeah.
is okay. So and night shifters will understand. You got to, stick together and make those bonds at work. And um, travelers, they, at least in my experience, they, congregate, especially if you're in a place that's not traveler friendly. You
Mhm.
got to have a good support system, and having a good one at work. And a home is important too, but, if you're working at this facility for 13 weeks, make buddies.
Mhm.
And as I said earlier, like, you have to have a good, like, thick skin backbone to face these things, because for some, especially in travel nursing, I mean, we've seen travel nurses who have had their mental health has gotten so bad they've lost their lives from it. So
Mm.
you have to be in a mentally good place uh, to. I mean, if I were to go back now, that would be like one thing I'd want to check with myself before I left to travel was like, am I like strong enough up here? Because when you leave that comfort of your staff job, you're essentially alone unless you have a travel buddy.
Right.
So you gotta always take care of yourself and surround yourself with people who support you, who can relate to you at work. And when you're home, do whatever you need to do to work out anything that you're dealing with, because before you know it, uh, the impact of what we do, it can like hit you like a lightning bolt, and 2 years later, after taking care of COVID patients, so many nurses are suffering,
Yeah.
and we weren't, given the support we needed. So we have to find that support for ourselves.
Mhm.
I could talk about this all day.
That you can. And I was just about to ask you, because I know you wrote an article recently
I did.
about
Yeah.
the impact of COVID-19 and things
Yeah.
like that. So coming out of that now, right? We're in a post-COVID
Mhm.
era. What have been some things or maybe some advice you have for those nurses who are in the same position, coming out of working, crazy amounts of hours, super stressed, being on
Yeah.
COVID units, having to see those different kind of
Yeah.
things. Like what piece of advice do you have for them?
I think the biggest thing I've taken away from the whole experience of working in the pandemic is, I stayed in bedside nursing for much longer than I really would have had I done what I wanted to do and done what made me happy.
Mhm.
And COVID taught us nurses and all, RNs, LPNs, CNAs, allied health, all um, clinicians, that life is so short and it can be taken away at any minute. So if, just do what makes you happy, and
Yeah.
you don't have to suffer in one job. There's nursing is amazing because there's so many opportunities.
Yeah.
And there's so many things you can do.
Yeah. That's something I learned about recently.
Yeah.
Like I'm an avid TikTok user.
Oh,
and
yeah.
For some reason I'm on Nurse Talk.
Oh, yeah.
So every time I'm like swiping through, there's like anesthesia and
Mhm.
like all this, like there's so many different fields that you can go in.
Yeah.
And it's so crazy because I mean, I couldn't imagine being a nurse. And I could like, oh my gosh, there's so many like I have a friend who does cosmetic nursing.
Oh, that's
So
cool.
she does like the
Yeah.
injections and
Mhm.
stuff. And I see her Instagram all the time. And I'm like, this is so
Yeah.
cool. There's so many different
Yeah.
things. I love it.
And what's great, there's so many different things you can do with nursing. And I would say, like, since working here, I've learned there's almost like a travel job for every type of nursing.
Yeah. Yeah.
It's not just like acute hospital, like long-term care, skilled, psych, school nursing. Like there's contract for everything,
Mhm.
which
Yeah.
is great.
I didn't even think about that. But yeah, you're absolutely right.
Yeah.
That's awesome. So after your first assignment,
Mhm.
you went on another assignment.
Mhm.
How was that?
It was so much better.
Yeah.
So I had extended my first assignment, so it was 13 weeks. I extended for another 13 weeks, earlier than I, probably should have. So after 2 weeks into my extension, I ended up leaving, and I left for a few reasons. I just wasn't really happy. I wasn't happy there, and so I wasn't going to stay there. Without getting into too many details. They were trying to pull me into coming in on my off days for training and education for travelers, and I'm like, that's why I'm a traveler. Like I like the flexibility and not
Mhm.
being tied to this hospital. I don't want to come in on my off day. I'm a night shifter, and you want me to come in at 8 a.m. for some like continuing education
Mhm.
that you say is mandatory, but like I got off, like I work nights. So
Yeah.
there's more to that. But so I went to another local contract, which was closer to my home than my staff job. I was like 15 minutes away. And the facility, it was amazing.
Mhm.
If I were to ever in my life go back as staff, it would be there because they treated travelers like their own. If you needed time off, they would accommodate you and not hold it against you and be flexible. And when I was to the point where I was just so burnt out with night shift, they were like, well, you can come to day shift if,
Yeah.
um, yeah, that was an incredible experience.
Yeah, that's awesome.
Yeah.
I love to hear that.
Yeah.
Especially after you had, maybe a little bit more of a chaotic experience,
Yeah.
being able to transition into something that really just opened your eyes to the community that travel
Yeah.
nursing has. And I know you brought up something earlier about, banding together and, walking through hand in hand. That's why I love communities like Gypsy Nurse, right?
Yeah.
Because it's everyone who's in the community together, able to share experiences and have those open conversations and ask questions. And it's just awesome to see so many different communities be able to come together and support one another.
Absolutely.
So many different people in those communities to be able to come together. So I love that.
Yeah, thank
I
you.
love that for you.
Yeah.
That's awesome.
I will say it does help that my best friend was there.
Oh yeah?
Yeah,
The second assignment?
Well, yeah, she was staff at my first assignment.
Mm-hmm.
And then she went there and I'm like, you know what, I'm going to go there. She's got great things to say about it. And so I guess I kind of followed her in a way, but I don't think she was mad about it.
I don't think you were either.
No, I wasn't.
It's a part of the community thing, right?
Yeah.
It just makes it easier to have someone, and then, whatever support you need, they understand more than maybe your family would, right? Because they're there, they see everything.
Yeah.
So awesome. Do we have any questions in the comments regarding CP and, CP? I'm so sorry. So we have this nickname for Christie, and I was telling her before we got on live, I was like, I'm going to try my hardest to not call you CP because her initials are CP, so we'll do that. Christie, do we have any questions in the comments for her? I'll give it a couple seconds to let some people type if there's anything. If not, then we can move on. Go Gypsy Nation, absolutely. Such an awesome community and platform.
When I was, looking at travel assignments, the Gypsy Nurse Facebook group was like one of my go-to resources for like reviews when I was going back and forth between like travel or local, and it's amazing. Like thousands of nurses that are in there.
Yeah, it's a huge community.
Yeah,
people.
We appreciate you guys. We appreciate you guys joining and being in there, because even like, you guys getting in there is like so helpful for everybody else too. Like giving you experience in there too. So now that you can like kind of like give back in there, I love seeing that when people are like, hey, like how do I become a travel nurse? And then like a year later, then they're like the expert and they're like, don't take that from that contract. And they're telling them.
Yeah.
You watch people evolve like over time.
Yeah. Oh yeah. Yeah. It looks like you have a question in here from Sage. It says, is there a chat you guys have for people to connect with and make buddies? I would say for us, the Travel Nurse Network group on Facebook, but you guys might have some other ones.
So currently we don't have any chats, but we do have all of our social media profiles. So if you're following us on LinkedIn, on Twitter, Instagram, Facebook, things like that, you'll be able to get all of our updates as far as like, anything we have going on with the company. You'll be able to connect with other travelers and things like that. So I would say just make sure you're following us on our social medias. We have all of our fun stuff on there. And our TikTok, yes. Me and Christy have been the stars of our TikTok page.
Someone else needs to take the mic.
But yeah, just make sure you're following us on all of our social medias and staying connected. Yeah, absolutely. And then, of course, Gypsy Nurse, you guys have a crazy amount of people in your community. I know Facebook is huge for you guys.
Yeah.
So being there.
Oh, sorry. Go ahead.
What's that?
I said, all you gotta do is get in there and say, hey, I need a friend, and people will come piling in.
Right.
Yeah.
Now you have 200 friends.
Yeah. 200,000.
Right. Awesome. So, Christy, regarding, I guess, like transitioning, right? What's been the one thing that you've seen that has made Medical Edge different than the other contract companies that you've worked for?
Okay. Great question. So I worked with two companies, and I won't name them, but they were very large companies. And once my recruiter at the time got me my job, I never heard from them again. like one went on maternity leave and I didn't even know it. So I tried to get in touch with her when I wasn't paid one time. And here I love how our recruiters like constantly check in with their providers, make sure everything's okay. Like they're always there. And even if they're like away from the desk, like they're you know, concerned about them. Like you just hear these conversations when you're in office that I'm like, are they talking to their friend or are they talking to a provider? And I think that's what makes Medical Edge really special. I know that if I were to travel again, and I'm not just saying this because I work here, I would definitely go for a company like Medical Edge. You know, had I never heard of Medical Edge, you know, and I was deciding now, the connections that are made here are what really make me, you know, I love this company for that reason.
Yeah.
When I worked with my agencies, I didn't even know there was a clinical services department. Like I didn't even know they had nurses working for their agency. And anytime I have, you know, like I overhear a conversation with one of our recruiters and their providers having some kind of conflict or issue, or they need clinical help, I'm like, did you not give them my number? Like, this is what I'm here for. Yeah. So, I think, you know, there's so many reasons, but I think those are probably the top two.
Yeah.
You know?
Absolutely. And I think you have such a unique perspective because being on one end where you are a contractor and then being on the other end where now you're working with the contractors or with the providers, I think it's so interesting to see the different perspectives that you have.
Yeah.
You know, and then be able to use that experience from the past and apply it to what you're doing now. I think that's awesome.
And I learned something new every day talking to our providers. We have a lot out in Colorado that I talk to very frequently. And, you know, I mean, I've realized I had it fairly easy for, in the short time that I did do contract. I was very lucky, and so many travel nurses are not lucky with great assignments. And, I learned so much from our providers every day.
Yeah, that's awesome. So we actually have a question from Steve, and he's asking, what are some of your favorite cities to recommend for travel nurses for first assignments? So I'm not a nurse, but going based on our providers, our current providers, and, you know, whenever we do have new people coming in and they're asking about different locations, some of the more popular locations I've seen have been California. That's not a city, but California, the whole state. Colorado, also not a city, but the whole state. New York, for some reason. I love New York, but I don't know how healthcare is out there.
I've heard it's rough.
Yeah, right?
Yeah.
Florida. I mean, really, it just depends on what you're looking for, right? Like what type of climate or environment you're looking to be in. If you're looking for warmer climate, maybe closer to the beach, then yes, I would say California or somewhere in Florida. But if you're looking for maybe something a little bit quieter, a little bit more calm, I would say like North Carolina or maybe Texas or something like that. Or if you're looking for cold, always cold, then Wyoming or Colorado or Oregon or something. But it completely depends on you and, you know, what you're looking for. Do you have any feedback on that? Because I know you talk to providers as well.
Yeah, best places to travel. Well, if you're experience driven, not money driven, exactly what you said. I mean, I've got a bucket list of places that I want to visit, and if I, you know, the opportunity, you know, working and traveling and going wherever you want to go, like I'd pick somewhere new every time.
Yeah,
you know?
absolutely.
Yeah.
If I was a traveler, I would definitely go somewhere new and those dream destinations, right? Like I would go to Los Angeles for a little bit because I love the scene out there.
I would go to Hawaii.
Oh, absolutely.
And from, you know, when I was researching a while back, you know, like over a year ago, I found a lot that Hawaii is like a great place to be a contract nurse or travel nurse, but like you go there for the experience, not to save money because the cost of finding housing there is so expensive. But I mean, it's Hawaii. It's work in Hawaii for 13 weeks, 8 weeks, you know, however long. And like, it's so cool.
Yeah, absolutely. I'll definitely do Hawaii.
Mm-hmm.
Florida for sure too.
Yeah.
Between Miami and Orlando, my off days, I'd definitely be at Disney World. No
Yeah.
question.
Mhm. Oh, yeah.
So yeah, great question, Steve. Are there any other questions in the comments? Got anything else? All right. So, do you have any questions for me, Christy? I know I've been like asking you questions this entire time. You got anything for me?
So what, from your perspective, what do you think Medical Edge, I worded that wrong. Why Medical Edge over any other agency?
Yeah, so I think you really hit the nail on the head as far as building the connections.
Mhm.
That's been my favorite thing to experience so far and to see so far. So we're all in this office together,
Mhm.
right? You hear all the conversations the recruiters are having. I hear all the conversations the recruiters are having. And there's always a new connection being built,
Mhm.
and people actually care.
Mhm.
So it's more than just filling a job or anything like
Yeah.
that. It's really about building that connection, getting a true understanding of what the traveler, what the contractor is looking for, and finding something that fits for them and
Mhm.
not just placing them somewhere
Yeah.
just to make the money. It really is about building that connection and having that be, the baseline of their relationship.
Mhm.
So I love that.
And then
It's-
once they're placed and they find a job, where they're ongoing for support,
Mhm.
not just when their contract is up and time to find, they're not just a dollar sign
Right.
to us. They're more than
Exactly.
that. So yeah.
And I love that I've heard our recruiters ask, like, hey, so what's a good time for me to follow up with you? Or they ask, like, what's a good
Yeah.
frequency? Do you want to
Yeah.
check in every week? Do you
Yeah.
want to do daily? Do you want to do monthly? Do you want to
Yeah.
be hands off? They ask those questions to get a better understanding of what you expect.
And
out of them.
those questions were never asked to me.
Mhm. That's something different, right?
Yeah, and I think, absolutely.
Yeah, it's
Christy,
awesome.
would
I
you?
love.
Oh, sorry. I
No,
was
you're
just
good.
Christy, would you think like as being a traveler before, would this be like a great first company to work with? Would you rather work with this one like for the first time, or how did you feel about it?
Oh, absolutely.
Instead
When
of
I
awkward.
was doing, no, that's a great question. When I was doing, and I think you don't realize what you need till you go through it a lot of times. So
Mhm.
many people, including myself, go for those name brands. The first
The name brands.
or that. I need to drink my coffee.
I feel like you guys are a name brand, though. I feel like you're definitely up there now.
That's so funny.
The larger companies,
Right.
those are the ones that pop up on your Google search and the
Mhm.
one that everyone's heard of. But being on the other side now, had I known that there were companies like this and the support that could have been available, and I would definitely choose Medical Edge or a company like it for my first contract.
Mhm.
We care about the person as a whole, not just the job they're doing. And I don't think every company can say that and really mean it. And, not just because I'm an employee here now, but just nurse to nurse or nurse to healthcare worker. I definitely think we're like a diamond in the haystack, or
Yeah.
Yeah.
Is
that a
is that
saying?
the phrase?
Or I
Diamond in the rough, or
Close
needle in a
Needle
haystack.
in a haystack.
That's close enough. But I agree, right? I think we have a very unique ability to kind of cater to, whether you're a new traveler or an experienced traveler or anything like that. We really do cater to the provider and what they're needing.
Yeah.
Right. So as we ask those questions, we have those open conversations about, what you're needing as a provider, whether it's your first time traveling or this is your 19th assignment with Medical Edge.
Well, it sounds
And
like. Oh, go ahead. Sorry.
I was just gonna throw in, like, we won't, if we don't have what you need or what you're looking for, like, we're honest.
Yeah.
We're not gonna play games with you.
Mhm.
Yeah.
Absolutely.
And it sounds like from what you were saying, Ashley, that like they're asking the questions that like the nurses aren't even thinking of, like, well, when do you want me to follow up? When do you want, like, how do you want this? And they're probably like, oh, I didn't even think about that. Like, oh, like, it sounds like they're very on top of it. So it sounds like a great first agency to work with, or forever agency to work with.
Forever agency.
Don't ever leave them, guys. If you sign up, don't ever leave. Hotel California, but Medical Edge Recruitment.
So we got another question from Steve. Thank you so much, Steve. So how important is the relationship with your recruiter in travel nursing satisfaction?
Very good question. I think it varies by person. I think what I would say might not be the same that another travel nurse would say. I personally think it's very important. For me as a travel nurse, I would want a recruiter who hears what I want, who isn't just trying to get me into the job the quickest they can. For example, I had a recruiter. I told them I wanted to, stay local within like an hour of my home, and they're sending me contracts like 4 hours away up in Dallas. And I'm like, did you hear our conversation that we just had 5 minutes ago on the phone? So
Yeah.
I think for me, it's important to me, especially if the recruiter wants to build a lasting working relationship, then having a great, relationship is very important.
Yeah.
But if you are someone who might, jump from agency to agency, then it might not be that important. It all depends on what you want for the long term. And every person's different.
Yeah, absolutely. I think in the long run, it's important to have some kind of relationship with your recruiter, though, because if you do have any challenges or, any issues that come up, being able to reach out to them and ask them a question, or give them a call or shoot them a text, they should be available, right? So having some kind of a relationship.
Yeah, absolutely. And I think I might have misinterpreted the question a little bit now that you say that. But you're absolutely.
I think we're hitting on the same line, though.
You think so? Okay.
Yeah.
Well, you've got to have a relationship, because if anything happens, like I didn't have a relationship with my recruiter, and I didn't know that there was other departments I could reach out to.
Mm-hmm.
But fortunately, I didn't have any issues where I needed them. But had I had, I wouldn't know where to go.
Right. Yeah. And to hit on that, Medical Edge is very intentional about giving you all that information up front.
Mm-hmm. Yeah.
So in one of the first emails that we send out to a new traveler, a new provider, we're letting them know, we're giving them a full sheet of every department and their email and their phone number, and saying, hey, reach out to this person if you have a question regarding this. Yeah. The email to payroll and HR and credentialing and onboarding and provider experience and clinical services. And we can throw IT in there if we want to. But we're very open about those lines of communication, and we make sure that all of our providers have that information.
Yeah.
And even if they don't, and they contact us and say, hey, like I have this issue, I get it all the time where people will send me an email and let me know about something that's going on. And I'll just let them know, like, hey, I don't have an answer for you, but let me go ahead and connect with another person in this other department. I'll have someone contact you. If they don't reach out, just let me know. We'll follow up. We'll get this issue handled for you. And I know the recruiters do the exact same thing, right? They're following up. They're making sure you have your question answered. They're making sure, anything that you need is being taken care of. So I love it.
Any more? I think that's it.
Do you have any more questions for me? I was like grilling you in the beginning.
I know. What's your favorite part about your job?
Ooh. My favorite part is definitely building connections.
Yeah,
absolutely. I love being able to talk to our contractors and having those conversations, getting that feedback, asking them, about their assignment, about the facility, about their recruiter, and have there been any challenges? How was your day?
Yeah.
How are your kids? How's your dog?
How's your mom?
Right. Like, I'll sit on the phone and have like a 30-minute conversation with a contractor. I remember one time there was a contractor who was telling me about like her recent vacation and her travel. And I was just sitting there and I was like, for her to even be this comfortable to tell me about everything, like obviously I'm doing I'm doing something right.
You are doing something right.
So it's awesome. I love building connections. And that's just not with our providers either, like with our recruiters, with
Mhm.
everyone,
Yeah.
in the company. Like I love being able to build connections and collaborate
Yeah.
and everything like that. So that's my favorite part,
Awesome.
especially because I'm able to work with like every department,
Yeah,
because if our provider has a question about HR, I'm
Mhm.
able to connect with them
Yeah.
and get a better understanding myself. So if someone else has the same question, I'm able to answer it
Yeah.
for them. And same thing throughout all the other departments.
Yeah.
So it's awesome.
Good.
We actually have a question from Shannon. Oh, that's not a question. That's an exclamation point. Obviously, I can't see. But she says having a recruiter that can point you in the right direction when you need it is critical. Love it. Absolutely.
Yeah.
Absolutely. I think it's so important to have someone that's being your advocate,
Yeah,
right?
your best interest.
Exactly.
Mhm.
Like if you have a question, you have a concern, you have something going on, it's important to you. It should be important to them.
Mhm.
So I
We're
think
we're not here without our providers. So
exactly. Right.
Yeah.
And that should always be the relationship, and that should always be in the back of the recruiter's mind.
yeah. And I truly believe that it is.
Especially here.
Yeah.
Maybe not anywhere else, but
Yeah.
here. Awesome. Do we have any remaining questions before we wrap up?
I'm not seeing
Crickets.
any. But thank you
Rachel,
all.
do you have anything?
No, you guys did a great job. It was really interesting hearing your perspective as like like previous to travel nurse and then now working kind of like on the agency side, which is awesome. I love when agencies have that because, you guys are like the real advocates and really putting your foot down and really taking care of business and taking care of everybody else. So just in a different setting. So always appreciate the clinicals.
Thank you.
Absolutely.
This was so much fun.
Yeah.
Yeah.
Awesome. Well, that is all. Oh.
Daisy,
Daisy at the last second. But the buzzer winner. So she says, how do you handle different pay? I cannot read. How do you handle pay differences, especially if you do not plan to switch companies? Thanks, Amy. Okay, how do you handle pay differences, especially if you do not plan to switch companies?
Is she meaning like agencies paying differently?
or maybe hospitals, different facilities that you go to pay, or say like I wonder, Daisy, let me know if this is what you're saying is like, so say you go to the hospital and you have the same position, but the both of them, oh, she said right, but I don't remember what was said. But both positions like oh yeah, I said the facilities part. So she said if she goes to a different facility, they pay differently. So I think it's just like, can you break down like how things are paid by facility, by specialty, because you're going to get paid differently by like the location. Okay, agencies paying different.
Gotcha. Okay.
Like every
Like-
agency has an individual contract with that facility.
Yes. Yeah. Okay. So I can answer this question actually. So thank you for clarifying, Daisy. I don't know if you saw like the question marks popping up. So every agency offers different benefits. So those benefits are calculated in the actual pay. So if a company offers a 401k and one doesn't, maybe the pay may be higher on one versus the other. So it really depends on what the agency is offering as far as benefits. And it also depends on what you're looking for, right? So if having a 401k is something that's important to you, it may put another company over another company for you. So do you have anything to add to that? It usually does depend on like the benefits though.
Okay, I see. I didn't know that. And
Mhm.
something, and correct me if I'm wrong, but I know like every agency they're not going to have the contract is not going to look the same.
That too, yeah.
So one agency might have a different like bill rate than another agency, and then with benefits and all the breakdown, pay might not be the same for the same job with 4 different agencies.
Yeah.
Depending on what each contract says.
Right. Yeah. Christie is
I
exactly
think,
right.
okay.
Yeah. So it depends on the contract that the agency has with the hospital or the client in general as well. So I would say if you are looking at the same contract or the same facility, and maybe a couple different agencies have, different pay rates, look at their benefits and see which one fits you the most. Like if you're wanting to get paid the most and don't really care about, health insurance or vision, dental, 401k, anything like that, then go with the higher paying one. But, it really just depends on what you're looking for. Good question.
And you can always ask the recruiter, like, why is
Oh.
this agency paying more?
Do not be afraid to ask the recruiter.
Always ask.
Absolutely. Any
And
questions
even
that you have, definitely ask.
And even same with like if you go to the same facility, there's a nurse that has the exact same, position, but then they're getting paid more. It might be they took like a lower stipend for their housing, so then their pay is getting better, or they're living in an RV or something like that. So even ask your recruiter questions, because there might be just a reason why someone got paid a little bit, maybe like $100 more, because their package was going to be different than yours.
Yeah. A lot of things can go into that, even down to like taxes and stuff. I know nothing about taxes. I'm not going to say anything else, but there's a lot of things that go into it.
Yeah. Well, she said, thank you. She's like, no, my onboarding with Medical Edge was seamless. So yay, good job.
Yeah, exciting.
And Daisy is one of Heather's providers, I believe.
Oh, awesome.
Yeah. Daisy, I've seen your name. I work a lot with the client. I'm not going to say where you're at online, but but yeah, I've seen your name a lot, and I hope your contract's going great. If you ever need anything,
let us know.
Let us know.
Awesome. Well, if there are no further questions, I guess we'll go ahead and close out. Thank you guys so much for joining us today. This was awesome.
It was fun.
We were a little nervous coming into it, but this was great.
Yeah.
And we really appreciate everyone in the comments. Shannon, woo! With another buzzer winner. So she says, last question, what's the number one thing a newbie nurse should look for in a recruiter? Ooh.
Well, I think a newbie nurse, I think honesty and transparency is key.
Mm-hmm.
And a lot of recruiters out there are they're driven by their paycheck, not by the nurse,
Mm-hmm.
or not by the whoever that they're putting in a contract. So being able to identify that they're there for you and they're not just trying to make a buck off of you, and that they've got your back and they're gonna not mislead you into a crappy contract.
Absolutely.
There's a lot of important things. So that's why it's so, like, joining the Gypsy Nurse group is a great starting resource. To search, just post in that group. There's, I'm sure, hundreds of thousands about that that can provide insight.
Yeah, and just trust your gut, right? So if you're getting a bad feeling, a bad vibe from the recruiter and you're not really sure, trust your gut. It's there for a reason. Just go based on, everything you've seen. Take everything as face value. If they're being, maybe a little sketchy or some things aren't lining up, do not be afraid to ask questions to clarify. Because at the end of the day, you're taking this assignment. This is going to be your career and everything like that. So just make sure you're asking questions to get a better understanding when you maybe have a little bit of confusion. But really just trust your gut. You can tell when someone's sketchy.
Yeah.
Awesome. Any more buzzer hitting questions? I love it though.
Well, thank you guys so much for joining us. We love having you on. You're so insightful and so much fun to have on. I know you always say you're nervous, but you always do amazing. So I know our community definitely appreciates it. It's, nice to see a face and hear like great conversations. So thank you.
Thank you so much,
Rachel. You're so sweet.
And if anybody has any other questions, like Ashley said, just follow them on their social platforms, Medical Edge Recruitment. You can DM them, message them, comment and ask them questions, or just tell them how great they are. And you can do all that. So be sure to reach out to them.
Awesome.
Thank you so much.
Thank you guys.
Bye.